Hello, I'm Jay Mehmet. Let's take a look at strategic family therapy. This particular model of family therapy was developed largely by Jay Haley, but also by Chloe Madonis and colleagues at the Philadelphia Child Guidance Clinic and subsequently the Family Therapy Institute of Washington, D.C. Jay Haley worked with Milton Erickson, Gregory Bateson, and Salvador Minuchin. He started the Family Therapy Institute in Washington, D.C. He helped Minuchin start the Philadelphia Child Guidance Center in 1967. He retired in 1995 to La Jolla, California, and he died in 2007. Now, strategic family therapy is concerned with a variety of things. First of all, family rules, the overt and covert rules that families use to govern themselves. Another concept is family homeostasis. The term I prefer to use is steady state. Nonetheless, this is the tendency of a family to remain in the same pattern of functioning and less challenge to change. Then there's also the notion of quid pro quo. And this is the tendency of family members to treat others in the way that they are treated. There's the redundancy principle. This is the family's repetition of limited behavioral sequences. The concept of punctuation, the belief that what individuals say is caused by what others say. Symmetrical and complementary relationships. These are relationships among equals and unequals. And circular causality. Events are interconnected and behaviors are caused by multiple factors. Short-term strategic interventions are designed to change the family process and structure. These interventions magnify the problem or they rid the family of the presenting problems. By targeting the entire family constellation, the therapist attempts to expand the family's resources. And this expansion can bring about change so that the family no longer considers a child as a problem, but rather concentrates on becoming more equipped to handle family crises. Well, this would just be a specific instance. There are many others. There are 9 needs for success. First of all, the family must ask for help. They must hire the counselor or the therapist, and the counselor or therapist is not thrust upon the family. The family must be in agreement with the therapist or the counselor about what is to change. And the problem needs to be changeable, not incurable. And this is where the definition of the problem is critical. There must be agreement that the family problem will be solved without expelling someone or excommunicating someone. Change must occur in the same environment in which it started. The family must have confidence in the counselor or the therapist, and each family member must feel connected to the counselor or the therapist. The referring party comes to the first session to assure the family that the counselor or the therapist is in charge of their treatment. And this is a form of linking. It's handing the baton from one therapist or referring party to the other. The therapist must spearhead the treatment. All decisions must pass through him or her. Now, here are some common problems that we see when you do strategic therapy. In single-parent homes, the problem is the parentified child is given responsibility to take care of other children in the family or other family members, but is not given authority. So what you use is what's called the deputy strategy. And we'll talk more about these things in our face-to-face class sessions. Another problem is the overwhelmed mom, and this is where you use the support strategy, and in some cases the pretend strategy. The problem is enmeshment or neglect. And here is what you use, what's called the roommate strategy. Another problem is the three-generation home where grandparents are in charge, and this is where you use what is called the spoiler strategy. Then you have the problem of revolving boyfriends, and this is where you use the powerful person strategy. Then you have the problem of the non-custodial parent who tries to dictate life in the custodial home, and this is where you use the contract strategy. You can also have problems with oppositional children. And one problem is that the hierarchy is not intact. There's often a distant dad or father figure. So the question is, how can dad make his presence and authority known without ignoring or becoming abusive? Another situation is that at least two parents are in conflict. Is there a grown-up or an agency on the kid's side? Has the parent or have the parents given authority to outside forces? Are the parents distracted by another problem? When dealing with these situations, especially with oppositional kids, the parent must be in control and must be in control of the timing, the topic of the interaction with the child or the adolescent, and the parent must be in control of his or her own temper. You need to realize that the child is more concerned about the process rather than the outcome. The reward is to get the parent involved in a ridiculous, heated argument. The counselor or the therapist must stay joined with the parents and connected to the child. What keeps the parents from working as a team? This is an important question that you need to answer. The kid needs to face two adults when confronted. Two adults that are on the same page, on the same team, working together. There are basically three parenting strategies, and again, we'll talk more about this in class, but there is the mystery strategy, the nuclear bomb punishment strategy, and absurdity. When working with parents who have problems with kids or teenagers, it's important that the parents know the peers and everything about the peers of their children or their child. So the parents must know the other parents. The parents must know license numbers. You need to emphasize behavior than who does what. And the counselor needs to reinforce time with good peers. There are often problems around divorce, and divorce is a transition. It's not a form of pathology. Divorce affects children in three ways. Loss of a parent. You have conflict that causes 75% of the non-custodial parents to withdraw. The custodial parent is often chronically angry, bitter, or depressed. And then another problem is that the parents fight over the children like they are property. So parents need to learn to focus on their children's problems, not their own. And the counselor or the therapist needs to encourage parents to follow the legal decree for 1 or 2 years to give time for anger to subside. Now, in a normal divorce, mom and the kids assess the situation. You need to privately persuade mom to let the counselor talk to dad. When you talk with dad alone, you need to talk about what kinds of relationships do you want with your kids. And when you talk with the parents alone, after they both feel connected to the counselor, then you need to focus on negotiation and then move on. Often you'll have a situation where dad still loves mom, and this is post-divorce. Kids are usually stuck in the middle. So what is suggested is you bring the entire family together and let the parents talk about how the kids are doing. Are the kids carrying on dad's fantasy of being back together again? The family is told that there is nothing the kids can do to get the parents back together again. When dealing with step-parents, the therapist, the counselor needs to help step-parents avoid loyalty binds with the kids, to earn the right to parent, and to be kind, loyal, and to serve as an adult role model. There are typically three common step-parenting problems. One is that the step-parent doesn't have enough power, the step-parent has too much power, or the parents dump the kids on the step-parent. And here are some solutions. Emphasize the marital dyad first. Emphasize dyads, not family activities. Privately ask the parent, what do you see the step-parent's role with the children? The counselor or the therapist needs to align with the weaker of the couple to encourage assertiveness. The counselor also needs to work in collaboration between step and parent when there are just a few problems instead of when there are crises. These are just a few things with regard to strategic therapy. We'll talk at length about these things in the face-to-face sessions and in subsequent presentations. Thanks for your time.